Stop scrolling. This is something most people only realize when it's already too late. I'm a doctor, and what I'm about to tell you could completely change how you understand pregnancy safety in just a few seconds. Because there is something frightening that can happen silently inside the womb. A baby that should be growing normally suddenly slows down. No alarm, no obvious pain, no clear warning, and the mother often feels completely fine. That's the most dangerous part. Now imagine this for a moment. You go in expecting everything is okay, but an ultrasound shows your baby is not growing the way it should, and you had no idea. Right now, I want you to lock into this one thought. What if everything feels normal, but something important is already going wrong? Because in this video, I'm going to show you clearly why this happens. The hidden causes most people never hear about. And when it becomes medically dangerous but don't rush ahead, this first part matters most. If you understand this, everything else will make sense. Don't scroll. This is more important than it looks. Most people only find this out too late. Stay with me. This can change how you think about pregnancy safety. This is where silent problems begin. You need to hear this before anything else. Everything may feel normal, but your baby could already be struggling to grow. As a doctor, I've seen something I never forget. Parents sitting in front of me, completely calm, even smiling, believing everything is going perfectly in their pregnancy. And then I have to tell them something they were never expecting, that their baby is not growing the way it should inside the womb. One mother said something I still remember clearly. I felt completely normal. I thought everything was fine. That sentence sounds harmless, but in medicine, it can hide one of the most important dangers in pregnancy. Because the truth is this. When a baby stops growing properly, the body does not always send obvious warning signs. No pain, no dramatic symptoms. Sometimes even the mother feels exactly the same as before. And that is where the danger begins silently. Today, I want to explain this in a way that is simple, calm, and clear, so you don't panic, but you also don't ignore what matters. Because what I'm talking about is called fetal growth restriction. It means the baby is not growing at the expected rate inside the womb compared to what we normally see at that stage of pregnancy. But here is what most people don't realize. This is not always something you can feel, and it is not always obvious without medical checks. Now I want you to imagine something important for a moment. What if everything feels completely normal on the outside, but inside, the baby is quietly not getting what it needs to grow properly? That is why this condition is so serious and so often missed early. In the next part, I will show you exactly what causes this to happen, why some pregnancies are more at risk, and how doctors detect it before it becomes dangerous. But before that, I need you to stay with me, because understanding this early changes everything. This is one of the most misunderstood pregnancy conditions. What I'm about to explain is often missed until later stages. Stay with me. This is where early warning signs matter most. Most people don't realize this is happening until an ultrasound reveals it. You're about to understand something many parents wish they knew earlier. What it actually means. Medical explanation, high retention version. When we talk about a baby not growing properly during pregnancy, we are referring to a medical condition where the baby is smaller than expected for its gestational age inside the womb. But here is the part most people misunderstand. This is not something you can always see from the outside. A mother may still look completely normal. Her pregnancy may seem unchanged, the baby may still move, and because of that, everything can feel reassuring. But inside the body, something very important may be happening quietly. The placenta, the organ that connects the mother to the baby, may not be delivering enough oxygen or nutrients, and without enough supply, the baby's growth can slow down gradually over time. This is not always sudden. It is often slow, silent, and easy to miss without medical monitoring. That is why this condition can be so dangerous if it is not detected early. Now, I want to be very clear with you. This is not something you can reliably diagnose just by how the mother feels. And it is not something that always causes obvious symptoms. This is where many people become misled. Because in pregnancy, feeling fine does not always mean everything is fine. And that is the misunderstanding I want to correct today. Let me explain this in the simplest medical way possible. The baby depends entirely on the placenta for oxygen and nutrition. So if that supply becomes limited, even slightly, the baby will adjust by growing more slowly to survive with less. That is the body's way of protecting itself. But from a medical perspective, it becomes a warning sign that must be monitored carefully. This is why regular prenatal checkups are not just routine. They are essential. Because the only way we can reliably detect this early is through ultrasound measurements, growth tracking, and monitoring placental function over time. Without that, the condition can remain hidden until later stages of pregnancy. And by then, intervention becomes more complex. This is where early detection becomes life-saving. Because when doctors catch it early, we can monitor closely, support the pregnancy, and make decisions that protect both mother and baby. In the next part, I will explain what actually causes this condition and why it happens even in pregnancies that initially seem completely normal. But before we move on, understand this clearly. A silent problem is still a real problem, even when there are no symptoms. This is where most misunderstandings in pregnancy begin. What I'm about to explain is often missed without medical scans. Do not confuse feeling normal with everything is normal. This is the silent part of pregnancy risk most people never see. Early detection here can completely change the outcome. Main causes, why it happens, high retention doctor version. Now let's talk about something many people are really surprised to learn. When a baby stops growing properly inside the womb, there is not just one single reason. There are actually several different medical causes, and in many cases it is a combination of factors working quietly in the background. Let me explain this to you clearly, step by step, the way I would in a clinical setting. The most common cause is a problem with the placenta. The placenta is the baby's lifeline. It delivers oxygen and nutrients from the mother to the baby. So if the placenta is not working properly, even slightly, the baby may not receive what it needs to grow at a normal rate. But that is only one part of the story. Another important cause is high blood pressure during pregnancy. When blood pressure is elevated, it can reduce blood flow to the placenta. And when blood flow decreases, the baby may receive less oxygen and fewer nutrients over time. There is also maternal nutrition and anemia. If the mother has low iron levels or poor nutrition, the body may struggle to support optimal fetal growth. This does not mean short-term diet changes alone cause the problem, but long-term deficiencies can contribute significantly. Then we have smoking or exposure to harmful substances. These can directly affect blood flow and oxygen delivery to the baby, which can slow growth. Now, here is something people often do not expect. Sometimes the cause is genetic or chromosomal conditions. In these cases, the baby's growth pattern is influenced from very early development, and it may not be related to anything the mother did during pregnancy. And finally, we have infections during pregnancy. Certain infections can affect the placenta or the baby's development, which may lead to restricted growth. Now I want to pause here for something very important. In many real cases I have seen as a doctor, the mother feels guilty. She starts asking herself questions like, did I do something wrong? Did I cause this? But in most situations, the answer is no. This is not about blame. It is about biology. It is about how the body is functioning during pregnancy. And that is exactly why medical monitoring is so important. Because without regular scans and checkups, these causes remain invisible until the baby's growth difference becomes noticeable. This is why doctors take routine prenatal monitoring seriously, not to create fear, but to detect changes early before they become complications. Now here is what I want you to take away from this section. There is rarely just one cause. It is often a combination of medical factors, and many of them cannot be detected without proper monitoring. This is the part most people don't expect, and it is exactly why understanding this condition early matters so much. In the next section, I will show you the warning signs doctors look for, and what you should never ignore during pregnancy. This is the part most people don't expect in pregnancy complications. The cause is often more complex than people assume. Let me break this down in a way that actually makes sense medically. This is why regular scans are not optional in pregnancy care. What I'm explaining here is what doctors look for first. Warning signs. You should never ignore. High retention version. Now I want to talk about something very important, and I need you to pay close attention here. Because even though fetal growth restriction can be silent in many cases, there are still warning signs that doctors are trained to look for. And if you notice any of these, it should never be ignored. One of the first signs is the belly not increasing in size as expected during pregnancy. Now, this does not mean small changes day to day, but over time, if the uterus is not growing at the expected rate, it can raise concern that the baby is not growing properly inside. Another important sign is reduced fetal movement. Many mothers describe this as feeling that the baby is moving less than before, or movements becoming weaker or less frequent. And while babies do have rest cycles, a noticeable and consistent reduction in movement is something that always needs medical evaluation. Doctors also rely heavily on ultrasound measurements. If the baby's growth measurements are smaller than expected for gestational age, or if growth slows compared to previous scans, that becomes a key warning sign. Another factor we monitor is amniotic fluid levels. Low fluid levels can sometimes indicate that the placenta is not functioning optimally or that the baby is under stress. But now I need you to understand something very important. Even with all of these warning signs, there are cases where there are no obvious symptoms at all. The mother may feel completely normal. Movement may still feel present. There may be no pain or discomfort whatsoever, and yet the baby's growth may still be affected. That is why this condition is so medically significant, because it teaches us one very important lesson. Symptoms alone are not enough to confirm safety in pregnancy. This is where many people become misled. They rely on how they feel internally as reassurance. But in medicine, especially in pregnancy care, we cannot depend on feeling alone. We depend on measurements. We depend on monitoring. We depend on patterns over time. And this is exactly why prenatal checkups are so important, because they allow doctors to detect changes early, even before symptoms appear. Now, I want to be very direct with you. If you ever notice reduced fetal movement, or if something simply feels different than before, it should never be ignored. It does not mean something is always wrong, but it does mean it should be checked immediately. This is where many pregnancies become high risk, not because something suddenly happens, but because early warning signs are missed or dismissed. And that delay can make a difference in how we manage the pregnancy. So the key message here is very simple. You should never wait for symptoms to become severe before seeking medical advice. Early checking is always safer than late reaction. In the next part, I will explain how doctors diagnose this condition in detail and what actually happens during those scans. This is where early warning signs become medically critical. Do not wait for symptoms to become severe. What I'm explaining here is what doctors actively monitor. This is where small changes can matter more than you think. Never assume everything is fine without confirmation. How doctors diagnose it, high retention version. Now let me take you inside the clinic for a moment, because this is where things become very precise. When we suspect that a baby is not growing properly, we do not rely on guesswork or appearance. We rely on measurements. The first and most important tool we use is an ultrasound scan. During this scan, we measure the baby's head, abdomen, and femur length. These measurements are then compared to standardized growth charts that tell us what is expected for that stage of pregnancy. If the baby is smaller than expected, or if growth is slowing compared to previous scans, that is when we start to pay very close attention. But that is only one part of the evaluation. We also look at blood flow in the umbilical cord. This tells us how well oxygen and nutrients are actually reaching the baby. If blood flow is reduced or abnormal, it can indicate that the placenta is under strain. Then we assess placental function, because the placenta is the system responsible for supporting fetal growth. If it is not functioning efficiently, even a healthy pregnancy can become high risk over time. We also carefully measure amniotic fluid levels. Low fluid can sometimes suggest that the baby is under stress or that the placenta is not working at full capacity. Now here is something very important that most people do not realize. A single scan is not always enough, because growth is not judged by one moment. It is judged by patterns over time. That is why, if we suspect any issue, we often repeat scans every 1 to 2 weeks. This allows us to track whether the baby is growing steadily, slowing down, or stabilizing. And this repeated monitoring is what gives us the clearest picture of what is truly happening. Now, I want to be very clear with you. This is not done to create fear. It is done to detect changes early enough that we can act safely and appropriately. Because when we identify growth problems early, we can adjust care, increase monitoring, and make decisions that protect both mother and baby. This is how we catch it early. And this is exactly why modern prenatal care is so powerful. Because without these tools, we would not be able to see what is happening inside the womb with this level of accuracy. Technology plays a life-saving role here, but only when it is used consistently. That is why follow-up scans are not optional in suspected cases. They are essential, because each scan is not just a picture, it is a comparison, a timeline, a story of how the baby is growing over time. And in medicine, that story is what guides every decision we make. In the next section, I will explain what doctors actually do once this condition is confirmed, and how we manage it step by step. This is where diagnosis becomes very precise, not speculative. What we are really looking for is a pattern over time. Each scan tells part of the baby's story. This is how we separate normal variation from real risk. This is where medical monitoring becomes life-saving. Now let's talk about something very important. What happens if we confirm that a baby is not growing properly? At this stage, many parents feel fear immediately. But in medicine, a diagnosis like this does not mean nothing can be done. It means we shift into careful, active management. As doctors, the first thing we focus on is identifying and addressing the underlying cause if possible, because sometimes improving one factor can significantly improve the situation. For example, if there are issues related to maternal nutrition or anemia, we work to correct those. If blood pressure is high, we manage it carefully to improve blood flow to the placenta. At the same time, we do not stop at treatment alone. We increase monitoring significantly. This means more frequent prenatal visits, more ultrasound scans, and closer observation of fetal growth patterns over time. Because in these cases, time becomes an important factor. We are not just treating. We are watching closely for any change in the baby's condition. Now, here is something very important to understand. In some cases, if the baby's condition begins to show signs of stress, or if continuing the pregnancy becomes riskier than delivery, doctors may recommend early delivery. This is never a first step. It is always a carefully considered decision based on the balance between fetal maturity and safety, because the goal is always the same in every case: protect the baby, protect the mother, and choose the safest possible timing for delivery. Now, I want to be very clear with you. This is not about panic. This is about precision. When fetal growth restriction is detected early, we have more options. We can monitor more closely, we can intervene sooner if needed, and we can significantly improve outcomes in many cases. But when it is detected late, those options become more limited, and that is why early detection changes everything. Because in pregnancy care, timing is one of the most important factors we have. Let me also say something that many families need to hear. This diagnosis does not automatically mean something will go wrong. Many babies with growth concerns go on to be born safely with proper monitoring and medical care. But what makes the difference is how early we identify it and how closely we manage it. That is where modern medicine plays its most important role. Not in fear, but in control, observation, and timely action. And this is why I always emphasize follow-up care, because every checkup gives us more information. Every scan helps us adjust our decisions, and every measurement helps us understand whether the baby is stable, improving, or needs intervention. So when I say early detection improves outcomes, I mean this very literally. It gives doctors time, it gives options, and it gives the baby a safer path forward. In the final section, I will bring everything together and explain what you should remember most from all of this, and when you should never delay seeking medical advice. This is where diagnosis turns into active medical management. We are not just observing, we are making controlled decisions. Timing becomes one of the most important medical factors here. Early detection gives us options. Late detection removes them. This is where precision medicine truly matters. So let me end this with something very important for you to remember. A baby not growing properly inside the womb is not something that is always visible, and it is not something that can always be felt. In many cases, everything may seem completely normal from the outside. But inside the womb, changes can still be happening quietly. This is exactly why modern medicine relies so heavily on monitoring, measurements, and regular prenatal checkups. Because these tools allow us to see what cannot be felt, and to detect changes before they become serious complications. So if you are pregnant right now, or if you are supporting someone who is, please understand this clearly. Regular checkups are not optional. They are essential, not because something is wrong, but because they help ensure that everything is going right. Now, I want to speak directly to you for a moment. After everything I have explained in this video, I genuinely want your perspective, because understanding how people receive this information helps improve how it is communicated in the future. So tell me, did this explanation make sense to you? Was anything unclear or difficult to understand? Would you like me to go deeper into how ultrasound scans detect early warning signs before symptoms appear? And I also want your honest feedback on something specific. Which parts of this explanation felt the most helpful to you? And which direct engagement phrases made you feel more engaged or more likely to keep watching? For example, this is medically important to understand early. This is where early detection can change everything. This is something most people don't realize until later. Finally, I want to understand something important. What tone do you find most trustworthy when learning about medical topics like this? Is it calm and reassuring, urgent and serious? or emotional and storytelling based. Your feedback is not just helpful, it helps improve how this information can reach and help more people in a clearer and safer way. And most importantly, remember this. Understanding early means acting early. And acting early can make all the difference. This is where understanding becomes prevention. Clarity in medical information can change outcomes. Early awareness is the most powerful tool you have. What you understand today can influence decisions tomorrow. Your feedback helps improve how this message is shared. If you found this video helpful, please share it with your friends and family and leave a comment to tell me what you learned. Your support goes a long way in spreading the message and growing this community. Thank you and see you soon.